you also can't out supplement a bad diet. And that's where one of the first priorities for us is, where is this person's diet? How, because not everyone, a lot of people tend to say, I eat really well, I'm eating a perfect diet. And then we'll get deep into what that means to them.
Welcome back to another episode of the Smarter Not Harder podcast, your home for 1 cent solutions to $64,000 questions. I'm your host again today. My name is Dr. Scott Scher, and it's a pleasure to be back with all of you. Today, I had the fantastic pleasure to interview Dr. Leland Stillman. Leland is a friend now. He met him recently at a conference, and he's just a wealth of information and thinking about things in a very different way than most clinical practitioners out there, and very, very forward-thinking too. So in this episode, we spoke about multiple different things, but before I get there, here's a bio on Dr. Stillman. So he studied biology and environmental health at Connecticut College and received his medical doctorate from the University of Virginia. He then trained in internal medicine at Maine Medical Center. He practiced as a hospitalist for 3 years, following his residency and training, which I have done as well. He went on to found his own practice just before COVID. He has a longstanding interest in alternative medicine and now focuses on functional integrative medicine in his practice. So Leland mostly works virtually, and he works from Florida now, but he has really a great handle on something that I know very little about, which is called hair tissue mineral analysis. So we spoke about that in detail here and how he uses it in clinical practice, why he's found it to be so important, understanding how to replicate results over time, how to look at results over time and see how they change. It was very interesting to me because I've seen in the past how what I felt could be very variable in what the testing you could get when you get to hair tissue mineral analysis. But Dr. Stillman really does go through why that this is the case, why you may not see a lot of minerals initially, why you might not see a lot of heavy metals initially, but then when you start doing work and optimizing bioenergetics, and mitochondrial function, you will see benefits over the long term and see these change in how the hair tissue mineral analysis will change as well. We talked a lot about minerals. We talked a lot about foundational health and how understanding this is so important before you're doing a lot of other interventions in clinical practice. He talked about his various ways of thinking about how the future of integrative medicine is going to change, especially with group visits and group practices, and the slide back from completely going virtual to actually having an in-person part of his practice too. I really hope you enjoyed this episode with Dr. Leland Stillman. It was a lot of fun for me to record with him. I learned a lot about hair tissue mineral analysis and more, and I hope you do too. Now, if you like this podcast, please don't forget to like and subscribe below and share with your friends and colleagues. Have a great day. Enjoy. All right. Leland, how are you?
Great. How are you? Thanks for having me on.
It's a pleasure to have you, man. And so I was really interested in having you when we spoke at the Freedom Practice Coaching event many months ago now. And the reason for that was because you were doing things differently than most practitioners that I met, even people at that event, which is a very interesting event. And it sounds like you've been involved with that for a little while. But one of the topics that we spoke about, which intrigued me as a medical doc, as you are, was that you were very much and still are very much into hair tissue mineral analysis. Mm-hmm. So I would love to hear your story on to how you got into hair tissue mineral analysis and why it's become such a big part of your practice and your teaching.
So I got into integrative medicine when I was 14, 15, knew I wanted to do nutrition, functional medicine.
14?
Yeah, wow, really early.
Young. Okay. Yeah.
And I didn't know exactly what it was going to look like, but it was all part of a journey as a child. My mother fell out of the conventional medical system, very disillusioned with the results that my sister and I were getting as kids in the pediatric healthcare system. And she took us to everyone. Many of them were clearly charlatans, to be blunt. But I was fascinated by this promise of integrative and alternative medicine. And it was clear that there was some value to all of it. I just wasn't sure what it was. And when I got into the science of it all in my teenage years, I just could never shake the fascination with biochemistry. I took biochem a year early in college, took organic chemistry over the summer so I could skip into it, and never really fell out of love with pathways and just biochemistry. So that's really where it started.
The few, the proud. I got you.
Yeah, that's why I became a general internist too. I just wanted to know all the detail, all the things. And I like taking care of sick people because I just felt like drawn to, well, what's really going on? Why are these people really this sick? And then what's the best, most elegant way to get them out of their illness? So that was, I think, where it truly started. And then I got into, out of residency, I got into functional medicine at different clinics, and I saw different modalities. And I saw the trend was towards more and more intensive, high dose nutritional therapies with sometimes heroic doses, like out of the orthomolecular school, 1970s, 80s,
Yep.
Abram
I'm aware.
Hoffer.
Yep. Yep.
But I saw these high doses and I saw how unsustainable it was for most people. And it's sometimes you can make it sustainable, and sometimes it's just the pill burden, the pill fatigue. People coming to me, I'm on 20 supplements, I'm on 30 supplements, I'm not getting results. Why? And so I became really interested in I think it was Da Vinci who said, simplicity is the ultimate sophistication. And I
always talk about that with Tom Petty. He's one of my favorites of all time, but he had a 3-chord song.
No kidding.
To make a 3-chord song as beautiful as that, the simplicity is key. So I'm with you. Simplicity.
Right. Yeah. And I think that there's something, I don't know,
Absolutely.
And I just wanted to know how could I get results that other people aren't getting with 20 supplements, with 5? How could I do that? I went through training with different mentors, different schools of thought, different protocols. When I was in residency, I was reading books by Mark Hyman, Amy Myers, all the people who were leading the charge with functional medicine at that time. I went down a ton of different rabbit holes. And then at the end of all that, what I saw really working was protocols that were handed to me by a mentor who was a naturopath by his traditional training. And then I started to get into hair testing after he and I had a falling out, because it was like the next hill for me to climb. I had done so many blood labs. I did the NutriVal, the metabolomics, the ion. I did it all. And I did hundreds of tests a year. For a solo practitioner, that's a lot. And I spent a lot of time with patients counseling them, and I would do serial labs. We would get a NutriVal every quarter, every 6 months, track changes. And number one, I was impressed by the amount of noise that I thought there was in the functional medicine labs. We would treat a low glutathione and it would come back lower. And we would say, oh, you got a high glutathione or a normal glutathione? Great. And then 6 months later, it's low. What happened? I don't know. So I just started to have a lot of skepticism around some of the lab markers that were coming back to me. And I was still getting great results despite that. And then I thought, okay, so there's obviously a lot of value here. And what's the next test for me to tackle and learn how to integrate into my practice? Because I just always want to know what's the next thing I'm going to bring in and how am I going to integrate it all? I love the idea of integrative medicine. How do we bring together the best of all these worlds and make it as elegant, efficient, hard-hitting, impactful for people so that they get really great results? And I just said, okay, I'm going to start ordering hair tests. Didn't know what to look for, didn't know even how to interpret it. And I started to get these results they were amazing. I got a result back of an aluminum of 119. And the reference range on this test is like, the reference range for aluminum is 4. And having done thousands of them now, or hundreds, I don't know how many, I can tell you it's very rare to pop over 4. And so for me to get one that was 119, I thought, whoa, hold on a minute. No one's testing aluminum that I know of in the functional medicine space in a rigorous way. And this is where the hair became fascinating to me. So think about how hair is made. I say it's expressed from the body by the cell that makes the hair shaft, right? And it's literally pulling nutrients from the blood, passing them through this cell into this structure that then it gets built and expressed literally out of the body. And that's a weird tissue because it takes weeks to grow. You get a urine sample, it's the last 6 hours. You have a couple whiskey sours and your metabolomics is not going to look right. I've done that and I know. I mean, I had the health department call me once for a mercury level. I must have forgotten to not eat mahi-mahi or tuna like a couple days before my NutriVal, and the public health board, Dr. Stillman, do you know that your mercury level is 23? Yes, matter of fact, I do. Thank you very much for calling me and making sure that I knew that my mercury was 23.
I can't think the public health called you. Wow, that's impressive.
They've called my patients too. They will call your patients if you get a mercury level that's high.
Oh, wow. That hasn't happened to me. That's interesting. Maybe it's like...
What's the highest mercury you've gotten back?
150.
On a blood lab?
Blood. Yeah.
Dear sweet Lord, what happened to them?
Yeah. Yeah, it was somebody that was eating tuna every day or 3 days a week, thinking that it was healthy. This is very similar to a Tony Robbins story, actually, who talks about eating tuna once a week for 10 years or something and get mercury levels of that high. But My impression with the NutrVal was always more, I know there can be, like you were saying that like people would have a huge fish meal like 3 days before their NutrVal and their mercury level would be sky high, that kind of thing.
Oh,
Yeah.
but it also impressed me how the heavy metals would hide. So, for
Yeah. Yeah.
example,
Yeah.
I had a case who she had horrible GI issues, horrible. Most people think their GI issues are horrible. I don't have another case in my practice that can hold a candle to what this woman was describing to me. I don't even want to talk about it on air. And I'm a general internist, so it takes a lot to turn my stomach.
Yeah. Yeah. Me too.
So,
Yeah. But I can't do eyes. I don't know about you, but I can do almost any other body part. But if you come in with some crazy shit with your eyes, I'm like, you got to go see somebody else, man. I can't do your eyes. Anywhere else, I'm okay.
yeah.
But anyway, I agree with you. There's like an ick factor, even to some degree. Yeah. I understand. Proceed.
So, yeah, she had horrible GI issues. And then she had awful skin issues. We're talking, even the conventional dermatologists were putting her in the UVB light bed intensively to try and treat this. It was technically diagnosed as eczema. Okay. And I did all the normal functional medicine things, but she had a mouthful of mercury and her mercury blood level was like 13, 14. And I just knew her total body burden of mercury was too high. And I knew that what I was doing was going to be wasting time and money. And I said, hey, listen, if you're not willing to get this mercury out, I don't want to waste your time, your money, my time. And she actually got upset with my staff person who relayed this message to her. But my point with that is just, I knew that there was more to the total body burden than what I was seeing in the blood. And part of that was just that the hair test we do at Analytical Research Labs is like 20 something metabolites. The toxic metals you test are lead, mercury, cadmium, arsenic, and aluminum. Chris Exley's work, he's the foremost aluminum researcher in the world, I would say, by a wide margin. And his book, he describes what we're living through as the age of aluminum, the aluminum age. We're the first civilization, right? The Romans smelted things. They had huge industrial uses for everything from lead to iron. But we're the first civilization, so to speak, the last 100 years that's really taken aluminum, one of the most abundant elements in the Earth's crust, and turned it into everything from, there's like aluminum phosphate in food as a food additive. It can be a dough conditioner, an anti-humectant. It can be a preservative. It can be an antacid. Aluminum is an amazing chemical.
Deodorant, of course.
Yeah. Oh, it's so versatile, but it is clearly toxic. And I don't see anyone out there in the functional medicine space measuring blood levels of it. And when I started to get these crazy aluminum levels back in the hair, I thought, what am I missing? And the great thing about the hair is it's weeks to months, depending on how long the hair is and how fast it's growing, obviously.
Yeah, I was going to ask you about that. Yeah. So my question I have so many questions about it, but when you're looking at hair, I understand it as a cellular expression of the hair cell, but is there like a degradation of that as the hair has been there longer? So if you have much longer hair, and like where are the hair you actually testing? Are you testing like the tips? Are you testing like the follicle itself? Or does it have to be like a variation of these things to get a good sample? Or how do you typically do it?
So number one thing is to have sample to sample consistency.
Okay.
So generally speaking, what we coach people to do is cut this at the nape of the neck as close to the scalp as possible. Okay. And you want a 1 to 2 to 3 centimeter sample. Now, we have plenty of men who are bald, close to bald. They keep it super short. They don't want to grow out that kind of awkward 2 to 3 centimeter. Looks weird.
Yeah.
And so they want to keep it shorter.
So like a Hare Krishna or something.
Yeah, we've had guys send in quarter inch, even I guess 1/8 of an inch. But the point is, if you're actually collecting the hair quarter as it grows out, the really cool thing about that is you're not missing anything coming out of the body. And I love, because this is what I found. I would run heavy metal levels on the NutrVal all day, and it would be informative when I got a really significant abnormality. But those cases were pretty few and far between. And even then, you could convince me that it was noise, not signal. But when I started to see the hair, there were more consistent patterns. And I knew I wasn't missing any data. Blood can change day to day, right? So my mercury of 23 was a fluke. It goes down to 4, 5, 6 the average day. But what I think is so important about that with the hair that I started to see as I did, and the other thing I did was that when I started to look into the hair, I reached out to the only person I'd seen talk about it online with any kind of sophistication, and that was Clark Engelbert, who I now run a hair tissue mineral now.
Pardon the interruption. This episode is brought to you by Transcriptions, makers of precision-dosed, physician-formulated, and pharmaceutical-grade formulas in the form of a buccal troche. For this episode, check out Transcriptions Blue Cannatine. Blue Cannatine is a combination of nicotine, caffeine, CBD, and methylene blue to truly up-level your focus, your productivity, your feelings of just being able to get it done without the distraction. Go to transcriptions.com and save 10% on your order by using code POD10 at checkout. Now back to the show.
Analysis course and then mastermind with for practitioners. And
Awesome.
yeah, people will include links to that if people want to join.
Yes, please. We will.
Yeah.
Yep.
And so I reached out to him and I said, would you take a look at my hair test? And we went over it and he explained the thing that I think most people get confused about the hair, which is that the hair is, like I said, an expression of the nutritional and really bioenergetic status of the body. And this is the thing that will really throw clinicians off when they're looking at the hair. It's actually very common for people to have high levels of blood minerals and metals and low levels in the hair. And that's part of why it's been dismissed as a laboratory marker. People have said, we can't trust it because you'll have a high ferritin, high iron level in the blood, high iron level in the body. You could have a hemochromatosis patient. I actually happen to have one of the mutations for hemochromatosis, so I tend to get high iron. My ferritin, when I first started checking, it was in the 200s in my early 30s, which is unusual. I actually donate blood because of that. But you look at a hair iron level, and it actually is almost always low in someone who's ill. And
interesting.
It's not that the patient doesn't have enough iron, it's that they don't have the energy to express that iron into the hair and to incorporate it into that hair tissue. So one of the most consistent things you'll see is as people get older, they slip more and more into low patterns where there's no minerals coming out. They can be low just across the board. Everything's low, even the heavy metals. And it's not that the body doesn't have a high burden of heavy metals. We know that burden goes up with age because we bioaccumulate metals just like every other apex predator on planet Earth. To say that an 80-year-old doesn't have more mercury than an 18-year-old would be like saying that a great white shark doesn't have more mercury than a sardine. It would just not be true.
Yeah, it's a good analogy.
Yeah, and what you'll see is that as you optimize bioenergetics, and this is very much maps up with how patients feel, their sleep's better, their energy during the day is better, chronic diseases are improving, going away, fading away. Their hair, you see it come alive. The minerals start to come out in higher and higher numbers. We just looked at this with a health coach who I've been working with for a year and a half now. She's done 3 hair tests over about probably 18 months. And what you'll see often is these low levels in the beginning. You start to give people back
of everything.
Yeah.
Of everything.
Well, it's
even heavy metals.
It's not always everything because, and this is there's a lot I have still to, I have more questions sometimes I think about hair tissue mineral analysis than I have answers.
Okay.
And I'll give you an example. So it's not uncommon to get a high manganese or a high chromium level back from the hair.
Okay.
Now here's the thing. Where do you get manganese? You tend to get manganese from nuts and seeds. You can't convince me that somebody who, if I've got 2 patients who eat the same amount of nuts and seeds month to month, if one of them shoots up a sky high manganese level, that suddenly the manganese from their organic pecans just decided to make it out into the hair tissue. I don't buy that. Here's what the theory is that's currently reigning in the HTMA space. Those minerals are minerals from the environment that our bodies have accumulated that are then coming out in the hair. The body's getting rid of them. And this begs a question then of what type of mineral can the body utilize? And how do we judge that? For example, copper sulfate coming into the body. Copper sulfate's a pesticide. It's used heavily in organic agriculture because it is technically organic, because it's a natural product. But you will see these sky high levels of copper coming out of men who have elevated inflammatory markers. And sure enough, as they get rid of that copper, oftentimes you end up giving them zinc or other transition metals to help push the copper out. You'll see their inflammatory levels come down. That's something I'm actually hoping to publish here because we do have enough. I think we have enough high sensitivity CRPs that have gone from high to at least lower, if not normal, that I think it's significant, but I have yet to run the numbers on that.
Sure. So correlated with you working on a hair mineral analysis showing elevated copper levels,
Yes.
and then giving them zinc supplementation, and then showing how their CRPs would go down. Is that what you mean?
Yes. But as I mentioned
Okay.
too, and this is part of where subjecting it to the kind of reductionism that reigns in modern science is,
Sure.
the test is so complicated because,
Yeah.
for example, you'll have people who feel better and do better, but they don't push out any heavy metals in that time interval. Maybe they were pushing out other toxins. Maybe they didn't have a high toxic burden. They just needed to wake up their molecular machinery with methylation
Right.
cofactors and nutritive minerals and whatever. But back to this
Right.
available versus biounavailable minerals, you'll see these very high levels of nutritive minerals in the hair, but it seems like the body maybe can't use them because why else would they be pushed out into the hair? And I don't know the answer to that. I can only wonder, because manganese is a good example of this. So is copper sulfate. The body can't really use the copper sulfate. It has to cleave it off, and then the copper's got to be in the right conformation. And I have questions on the quantum level about minerals. Like we know, for example, that say deuterium, almost completely the same as just a regular hydrogen element. It's not exactly the same because of the kinetic isotope effect. If you've got water that's been programmed by red and infrared light, it's not the same as water that's been microwaved. How do I quantify that? I don't know what kind of manganese is coming out in your hair or copper. I can only surmise that as these things get dumped and people sometimes they feel worse. They feel like they're detoxing, but then they get through it and they feel better. And I'm very confident that what we're doing at the end of the day has real therapeutic value because I see these very strong trends in the high sensitivity CRPs in the practice coming into normalcy as we go through this process, which includes also, to be fair, group coaching. We talk about circadian rhythms. We talk about light therapy. We talk about all that. But as you probably appreciate, we as a practice, taking in the people we do, these are not newbies. They're not rookies. This is not their first rodeo. Many of them have already been across the country to see somebody like me, and they are already doing all of the things. And we don't have a lot of, sometimes the health coaching ends up being it's a lot more fine tuning, or it's sometimes dealing with they think 4 HIIT workouts a week is right for them right now. This is not true. We need to get you back to 30 minutes of this, maybe once or twice a week at most. You know what that's like.
Of course.
And then there's other examples of the minerals. For example, there's a manganese additive in gasoline that was added to replace lead as a catalytic agent. And it's called MMT. The exact chemical name escapes me, right? But I can only imagine the body can't use MMT. Manganese from an organic pecan is not the same as manganese that's added to your gasoline to dope it, to make it run better in your engine. And I can only imagine that inhaling that, which has got to be the average person's number one exposure to manganese, is also not the same as digesting the organic pecan in your stomach acid and then your pancreatic fluid in your small intestine, right? So I have all these questions because you'll see these big shifts, big moves on these tests. But the thing that really impressed me about the therapeutic value was when you get the protocols right and you follow them for long enough, you will see people just dump these huge amounts of heavy metals into the hair. The first case that really convinced me of the value was a young physical therapist from Virginia who came to us with infertility, and she'd already seen a lot of people. She'd done health coaching certifications. She was coaching with the Quantum Biology Collective at the time. That's how she heard about me. I looked at her tests. She had an old hair test that was classic for low levels of minerals and low levels of heavy metals. And you would have thought, okay, case closed, no heavy metals in the hair, check that box, no problem here. Give her some nutrients to top up her hair and we're done. And that's what a lot of the hair tissue mineral analysis that's being done out there is. It's just, these levels are low in the hair, let's give them. Don't fall into that trap. Because like I said before, I had a case this past month of a young kid with Crohn's who's got a serum copper of 177 and his hair copper's low. And if you don't know the correlation or lack of correlation between blood and the hair, you might make the mistake of giving that kid copper.
Yeah.
Not a good move. So anyway, this young PT came to us and I looked at the case and I said, I just have the suspicion that there's heavy metals, and I put her on a protocol. It was mostly based on functional medicine protocols that I learned along the way. We'll talk more about the protocols I use now in a minute.
Yeah, I
And
like that. Yeah.
she did that plus all the red light, sauna, grounding, stress reduction, mind body, the whole integrative medicine sink got thrown at this
Right. Your
case.
framework. Right. Yeah.
And her mercury levels, I think, tripled. In her hair, her aluminum level went from 0.39 to 8.57. So it was a 40-fold plus jump. And during that period of time, she had all these skin rashes and detox reactions, and she felt up and down. But that was a year and a half ago. And she just gave birth to a healthy baby girl on July 4th. And so
my
it's
birthday.
not like it was just the hair tissue mineral analysis, but she kept with it. And she said this was the thing that, as far as the supplements I took and the supplement protocols I saw working and moving the needle, that was what got her the result. And it was very profound, very impactful for me seeing that case, because that was like just a case study in what can happen when someone's really motivated and compliant and really embraces the whole paradigm of, I'm going to live a really natural life out in the sun, getting red and infrared light, avoiding EMF, and then taking targeted, personalized supplement protocols based not on, well, you've got Hashimoto's and we give all the Hashi's patients 200 milligrams of riboflavin and 500 milligrams of niacin and 30 milligrams of B6. And I'm not saying there's anything wrong with that. To be totally clear, I see lots of people doing great work with that out there, but my fascination with this arose because I was attracting their patients who were failing their protocols. And I said, what else is there? And that's where I ended up becoming fascinated by hair tissue mineral analysis, because it was this long-term picture of physiology. It was not like the blood, which I tell people sometimes, the blood is like the checking account of the body. If you're broke in your blood, you are really broke. And the thing is, even Bill Gates can overdraft his checking account. Doesn't mean anything about his net worth. You and I have both seen people well nourished. They like a marathon or 5K. They just get dehydrated. They get overhydrated. They wind up with a low sodium. It doesn't mean that they're chronically ill. So all of that is and then the fact that the test it's like $100. You want someone to do quarterly NutriVals. That's a significant cost compared to $400 for quarterly HTMAs. It makes a huge difference, particularly we end up attracting a lot of large Christian families. Like our biggest family is 7 kids, 2 parents. So you want to actually have testing for the whole family. That's a very hefty bill from Genova Diagnostics if you want to get everybody's NutriVal.
Yeah. So some questions here. So when it comes to looking at somebody like the patient you mentioned, the physical therapist who now got pregnant, which is fantastic, of course, and she had low levels of heavy metals in her hair and minerals as well. Did you see, she probably came with laboratory testing, say she came with a NutriVal.
I did a NutriVal.
Did it show, did it show significant amounts of oxidative stress, energy metabolism issues, mitochondrial issues? So the reason why I ask this question, Leland, is that would you have treated her differently? And how did you treat her differently? Because in the sense of, for me, if I see a NutriVal, for example, and I see that maybe there's no issues with the heavy metals, for example, but their oxidative stress levels are crazy, their antioxidant levels are in the tank, like their energy metabolism is all screwed up, like you're going to treat them in a very specific way, typically. That would probably be addressing many of the issues that you might be finding, I think, on hair tissue mineral analysis. But it sounds like you're able to go much more, detailed and specific, because sometimes you get those markers, but like in this case, you didn't, right? You didn't have those markers. So how did that sort of color your ability to change what your protocol would be, given the lack of things that you saw in this test, kind of thing?
It's funny you mentioned this, because at the time I was just getting into HTMA, and she'd happened to see another provider to get an HTMA. And so I saw it. I thought, oh, that's interesting. And then I got the NutriVal. And on the NutriVal, based on what I knew, I said, there's something, the more I'm learning about these metals and how they affect the body, the more I'm thinking there's heavy metal burden here. And it was part of what pushed me to use, in her case, 3 grams of glycine every day, and which has very powerful effects for mobilizing heavy metals in the body. And I don't remember exactly what it is. The funny thing is I have it on my old school EMR right here. I have a thumb drive that used to be my EMR. Those are the days when I was just a one-man show. So I've actually got the test right there. I could pull it up right now as we talk, but I don't want to get too distracted. And whatever I saw on that test, there are markers on the NutriVal where you could say, okay, there's definitely something going on that we're maybe not seeing in the blood, but is happening in the cell. So you definitely can. And then what impressed me about Because what happened was I reached out to Clark. Clark started to go over hair tests with me. And one of the first tests we went over was, of course, my own. I am my own guinea pig. And he said, you got to take close to 100 milligrams of zinc a day or something like that.
Pardon interruption. This episode is brought to you by Health Optimization Medicine and Practice Association, a nonprofit organization training practitioners how to optimize health rather than treat disease. For this episode, check out the exposomics module. This module is all about toxins in our environment, how we can find them, how we can detect them, how we can correct them, both from a lifestyle, behavioral, and also a supplemental perspective. We talk about hair tissue mineral analysis here. That can be a vital aspect if you are trained in how to do this. For any interest here, check out homehope.org and go to the modules and save 10% on any of them, including exposomics, by using code podcast10 at checkout. Now back to the show.
I was like, 100 mil, what are you talking about?
What? No, that's a lot of zinc.
That's crazy. That's the same as eating like 10 steaks. What planet are you on, Clark? And he said, look, I understand your skepticism of this, but here's what you've got to understand about what you're going to see when you start using the hair instead of the blood. You will give people these high levels of minerals and you will get better, more profound results because you're basically driving the car faster towards the destination. But if you don't have the hair, you're not going to know how fast you can drive. What I mean by that is you can have somebody who's going to do really well with 100 milligrams a day of zinc, and their blood labs are going to look exactly the same as somebody who's going to do horribly on 100 milligrams a day of zinc. And when you're dealing with 30, 40, 50 milligrams a day of zinc, a couple milligrams here and there of copper, 8, 15 milligrams a day of manganese, you're not moving that fast or aggressively with the minerals, and you're not going to tend to get the same big shifts in how somebody feels. And there's, I think, plenty of room here for people to do different protocols. Like someone I've talked to about hair tissue mineral analysis, Lisa Killa Patel, she runs a company called Vicon Customs. Her protocols for hair tissue mineral analysis use higher levels of vitamins than minerals in the ones that I started using and that I still am using. And I think there's a lot of individual factors here, right? Most hair tissue mineral analysis practitioners are dealing primarily with women. Women are smaller than men. Mm-hmm. I found that I liked the higher doses of minerals, but I'm 180 pounds, right? If you're saying, oh, well, we're going to have the same hair test and one's a 105 pound ballerina and the other one's a 250 pound linebacker. Well, if you're not weight basing that dosing, even though the hair test is the same, you should arguably. So we'll actually do that in the practice, and you won't find almost anybody who bothers to do that. And I'll also have a conversation with patients about how fast do you want to get this done? Because if we move harder and faster with higher doses of minerals and vitamins and everything from methylene blue to ozone to hyperbarics. We don't do that stuff because we don't do much of that because we're not in person. We don't have a brick and mortar space. We're 100% virtual, but we will refer out for it.
Right.
The thing is, the faster you move, the more you're going to tend to have people running into problems with that last hyperbaric oxygen session just knocked something loose in my physiology, and I feel terrible. And these are big.
Right.
I think people outside the integrative health space who don't actually see patients, I don't think they appreciate how powerful these therapeutics are and how a lot of the challenge to taking really good care of people is, how do I use these powerful therapeutics without imbalancing people, taking them out of their day-to-day life, making it impossible for them to do their job, take care of their kids. And I think part of that is because a lot of people are running around and they don't have the training to really know how to get people results. And that's okay, but that's why we have a hair tissue mineral analysis course where we train people how to read these, interpret these, and then work with people.
Yeah, I think you make a really good point because, Leland, from my perspective, this is where I got in trouble when I first started hyperbaric therapy, over a decade ago, because we would put people in the chamber that wanted to go in that were too sick. They had too much going on. Their system was so stressed, their ability to make energy, their ability to detox. And when you're throwing somebody into a hyperbaric chamber, or you're gently placing them, of course, into a hyperbaric chamber, and you're flooding them with 1,200% more oxygen, and you're creating all that stress in the system, it is stressful on the system. And so I was burned in the beginning because I didn't realize what we were doing. And people would get so severely ill sometimes after getting in the chamber. And we try to mitigate with things like going before and getting them glutathione or whatever it might have been for Lyme and severe heavy metal and things like that. But I found that if you waited, if you had time, and with most of these patients, it's not like this happened yesterday, right? It has been going on for a while. So if you waited 3 or 6 months, had them work with a practitioner like you, or I started my own practice to help working with patients like this too, that they would do so much better if you started some of these more intensive therapies, if you just waited those 3 or 6 months until they had a better foundation so they could really benefit. Because on the heavy metal side, just to give this kind of throw this back into what we're talking about, is that what hyperbaric therapy can do is really help with the flushing of these things and the mobilizing to some degree, but not a huge amount. So if you have, it can help with the inflammatory response related to moving heavy metals out of tissue is what it does. And that's great. But if you don't have the ability to actually move things out efficiently, you may actually see people not get a whole lot better and actually get worse because of their detoxification status. Anyway, long story short, saying I'm very much attune and agree with you that really focusing on this kind of work is really important before you do some of the heavy hitters. And this might be things like even ozone. And I'm sure you have experience with this, like even ozone hyperbarics, because these things can be too challenging for people to have before they start doing the work that you do. And this kind of dovetails into the question I had, you were alluding to earlier, is like some of your protocols related to heavy metal exposure and looking at the cadence of hair tissue mineral analysis testing that you do over time, if you want to go into that a little bit.
One of the things that won me over to this approach was that when you look at very fundamental physiology, which I think any general internist is at heart a little obsessed with, there's nothing more powerful than minerals. And just think about the toxic dose of something like mercury. So mercury, the toxic dose, lethal dose, the LD50 or whatever, is something like 0.5 milligrams per kilogram. That amount of mercury can, practically speaking, fit on the end of your finger. It's a very small dose. And there's literal stories of lab techs working with highly soluble, fat soluble types of mercury, dropping a few drops of mercury on their skin, and the next thing they know, they're dead. And why is that so important? When you've distributed around the body, it doesn't manifest as immediate death. It manifests as chronic illness and disease that won't, you feel like you can't get the horse back in the barn. You can't get this person's symptoms under control because literally the metals are spilling out of the tissue and they're creating all this oxidative stress. They're ruining mitochondria. And how do they do that? What is the mechanism? They displace the minerals that run fundamental essential physiology. So you've got mercury and arsenic and cadmium and lead and aluminum competing with copper and manganese and zinc and chromium. And you go into the real metal, and it's called ionomics, which I think is such a cool word.
That is a cool
word. So cool. Yeah. But you look at the ionomics of this, and that's how they exert a lot of their toxic effects. They basically, and the way I'll explain it to patients is I say, hey, you know how when you have a blender or a toaster that doesn't work quite right, you keep it around until you replace it? And they say, yeah. I say, okay, that's what your body is doing with the metals in your body. And the reason why you've done all the cleanses and the detoxes and you've done all the coffee enemas and the saunas, but you still feel this way, is that your body was like, that was the equivalent of you sending in a rainstorm to try and cleanse the scene. The broken toaster or blender is in the kitchen and the rain doesn't reach it. And you need to get the new blender, the new toaster, the new appliance in. That's the zinc, the manganese, the supplement. And then your body is naturally going to kick out the old blender or toaster because it knows it's broken and it shouldn't have it anyway. And that's part of why when you get the mineral blend or mix, you will see the metals come out of people and you'll see them feel better and come alive. That it's so foundational. And you just look at the numbers, like I was saying with the LD50, if you look at the numbers on what makes somebody healthy, most of our disease states are linked to where are the minerals, kidney stones, coronary artery calcification. All of this is minerals in the wrong place. And the way I think about the minerals is you have to have the right mix of minerals, and you also have to have the right mix of organic biomolecules, carbohydrates, fats, proteins to hold those minerals in the right place, just like the keystone of an arch or like the spark plug in an engine. And when you don't have that spark plug, even though everything else may be there, the system doesn't work the same. You take a spark plug out of an engine and all of a sudden $100,000 luxury car doesn't start, and it's a $5 part, and it gets back on the road. So I fell very much in love with the whole paradigm because I saw what you're alluding to, which is that if you do this foundational work of fixing the mineral system, and because along with it, you're going to have effects on methylation, because methylation comes back to minerals. When we use the protocols we use based on the hair, you will also use methylation cofactors. I can show people that on the hair tests and walk them through how it all works. But basically, you will fix these underlying problems, and then people respond better to all these other therapeutics, where often you're talking about pushing things like oxygen or ozone into a system where the minerals are not there to properly perhaps harness that molecule to do good, or are not there to cope with the stress that molecule is actually going to create.
Exactly.
And a big part of that ends up being that you also can't out supplement a bad diet. And that's where one of the first priorities for us is, where is this person's diet? Because a lot of people tend to say, I eat really well, I'm eating a perfect diet. And then we'll get deep into what that means to them. And we'll say, for you, where you're at and what's going on, you need to swap this for that, and increase this and increase that, and change this and change that. And that alone gives them a lot of mileage. And we love to do all this stuff before, because we just view this as teeing them up for the ozone, the hyperbarics. I had a recent case of Crohn's that I alluded to earlier with the high copper in the blood, low copper in the hair. I sent him immediately to hyperbarics, but it's because he's got fistulas and wounds. And I looked at the literature and I said, I want to get this kid as well as quickly as possible, because otherwise at this point, his case is so bad, he's going back on Remicade, and he's going backwards, sadly. So yeah, I totally agree with you. It's very rewarding to do this work because it is foundational.
Yeah, I love that. Yeah, and there are some times, like I think you just had a good example here, when there's an acute issue, like you just support the person as best you can and get them into the hyperbaric chamber, or do the ozone and give them like the minerals that you can to get them through whatever it might be. So there are definitely exceptions like that. I think the challenge with most people, a lot of clinicians in the integrative space, is if they have a technology or a practice that is more of an interventional kind of thing, they tend to want to do that faster than maybe they need to, when it's more about the base, the foundation, the diet, the lifestyle. But it's a challenge because a lot of patients, they just want to feel better faster. So we have to have a balance here a little bit. And that's why something like, I think you alluded to, and of course that I'm a big fan of methylene blue. I feel like that's usually a pretty good one for people because it can help support their mitochondrial processes and detox and energy enhancement at the same time as you're trying to do the harder work of doing the optimization and heavy metal detox, et cetera. So I'm sure you resonate with that.
Absolutely. Yes. And it's part of why I became an internist, because I was not that interested in intervening and in the sense of violating the human body with scalpels, needles. It's not that I'm not glad I've got colleagues I can refer out to for that, but I actually find it fascinating. Yeah. The original Hippocratic Oath, there's a clear line between the physicians and the surgeons. And the Hippocratic Oath actually includes an oath that you will not, and it's in the ancient Greek, it's cut for stone. You will not try to remove stones from the human body, which was like the only surgical indication in ancient Greece, right?
Interesting.
Yeah, but it says, I will not do this. I will let the surgeon do that. And I think that mindset is fascinating, because I do think where a lot of modern medicine's gone off the rails is that the GP, the internist, is supposed to be the brake on the interventionalist. And they're supposed to be able to say, no, this case is not appropriate for surgery. But what's happened is the general internist, the GP, has ended up becoming just a source of referral who has 3.5 minutes with the patient and doesn't have enough time to think or stay up on the realities of the subspecialty literature. So they don't know how to refer appropriately. Because the reality is, like, most back pain is non-surgical, just as one example. And what we see is tons of people come to us with problems that they thought, and maybe they already did it, ozone, hyperbarics, whatever. They'd already tried that and it didn't work for them. So what were they missing? It has to be more foundational. And sometimes we'll joke, some sort of joke that some patients have what we call shiny object syndrome. And there's nothing wrong with shiny objects. We use lots of shiny objects. I love shiny objects. I've got a whole storage container full of shiny objects, but there's no,
as many of us do.
of course, but there's no substitute for fundamentals. Just Mr. Miyagi, wax on, wax off. And
always,
And so as a general internist, that's what I feel. I don't know what it is that compels me to focus on that, but I love it.
Yeah, I was speaking to somebody yesterday. Dr. Mark Chang is a friend of mine. He's a movement martial arts guy, and we were talking about slow movement and fundamentals and all these elite athletes that he works with that he makes them stop doing everything, but like basically wax on, wax off for like weeks at a time. And then they get the fundamentals down and everything else gets better. But this is a good dovetail to talk about just for a couple minutes about where a lot of your work is now, which is in advocacy and understanding what the changes are going to be in integrative functional health over the next 5 or 10 years. I know you do a lot of work in this area, Leland. What do you think are the kind of the major trends or the major things that we need to be looking out for as physicians, as people that are inside the system? What are you excited about? What are you worried about? Give us your down low.
So the thing I think is most important for us to do is to communicate to the public that it's a combination, because the old model was just pay for consultative time with a physician. But when I was doing that one-on-one as a solo practitioner, what ended up happening was I would provide a very high level of service, but I could only take on 15, 20 people at a time because of how intensively I was working with them. And that's not a sustainable solution for our society. And I strongly believe we need great medical care available to people in a way that's sustainable. And the sustainability of it is a challenge as the buying power of the dollar shrinks, whether you like it or not. We've basically are challenged to do more with less in order to continue to serve people, unless you're comfortable with just high grading that top 1% to 2% of society or less as your practice. And the only way to do that is to communicate to patients that it's about group coaching, it's about online coursework, it's about them doing the work and showing up and paying attention to the fundamentals. Because if they don't do that, they're not going to tend to get the same results as the people who do. And they're going to be frustrated and they're going to feel, I don't know what the word is to say, like disillusioned and discouraged. And it's life. Everyone's going to struggle with those feelings sometimes. That's part of the deal. But we really I feel strongly that we need to really help the public understand it's not 1904. The default is not organic, local food. The default is not natural sunlight. You've got all these options that will destroy your physiology. And if you're not willing to spend a little bit of time learning how to be healthy and taking the time to set up a life where you're not inundated by air pollutants and water pollutants and toxic food and addictive technology, then you're going to end up throwing a lot of money away on medical care that just ends up being tire patching. And what I'm wary of is the integrative functional medicine space turning into it's just high priced, totally unreachable for the average person, because I think I don't want to live in a society where the average person can't afford to get great medical care like this. And there's some hard costs you've got to be able to cover. But if we message it correctly, if we explain it well, people will get it and they will be on board. And that's I think the future of integrative medicine.
I think that's beautiful. And I think really well said. I do worry about the price tag of integrative and functional medicine. I think you've found an avenue here with hair tissue mineral analysis that you feel very adept and strong about, and how this could potentially transform, at least to some degree, how people work, and doing a lot of these, like you said, the NutriValids every 6 months, which I tend to do in some patients. And I know it is an expensive, it's an expensive thing to do. I appreciate all this, Leland. I think it's really been great to get your perspective. I have just one more question for you. And it's a question that we ask everybody at the end of the podcast, which is, how do you recommend people live smarter, not harder? Give us 3 ways that you think people can live smarter, not harder. So it could be anything from medicine to lifestyle to behavior to family, whatever you think. I know that it could be just specifically to clinicians, because a lot of clinicians do listen to this, but 3 ways you think we all can live, or a subset of us can live smarter, not harder.
I think the most important thing, the longer that I do this, that I do every day, is to really work on the mindset and work on my own thinking. And I love the guy who I ended up hiring to coach me on this, Richard Brook, because he's really had a huge impact for me. But the
That's
more
great.
I work on that, the more valuable I think it is. And the more I think it's a big missing piece of a lot of people's puzzle. And then I think keeping life simple and not making it complicated is critical. It's so easy to make life complicated with technology. And I actually think it takes, I mentioned simplicity is the ultimate sophistication. I think it takes sophistication to prevent technology from making your life more complicated. And then I think we've had a huge push into the digital space the last 4 years for obvious reasons. And I actually think I now live in Naples, Florida, and I'm actually setting up local networks. I've never actually done that before. My whole business, everything's been online, virtual. I think Smarter Not Harder in the future is going to be actually having local networks, because I think that's where trust is highest, because you really do have skin in their game. And I think there's also an authenticity and there's a special something about sitting down at a table with people in person that is lost through the webcam. As much fun as it is to have, conversations like this, meet different people,
100% agree.
have big networks that are virtual, but I think there's always going to be a place for the in-person, and I think it's invaluable.
I 100% agree. I think as everything goes in the world, it always goes to one extreme and then has to back itself up to some sort of equanimity where you have the ability to do both. I certainly thought the same thing as many, that, oh, this is virtual, this is great. And I also really still enjoy seeing people in person too. Although having the option and having local networks, I think for a lot of different reasons is really important. So it's awesome that's been your path, and I resonate with it. And so tell people that are listening where they can learn more about you, some of your courses, and anything else you'd like to share.
So we have a practice in Naples, Florida. If you'd like to become a patient, go to stillmanmd.com. There's lots of buttons to get started. And it's just a simple complimentary discovery call to make sure we're a good fit to work together before we dive in. And then we have a coaching business called Stillman Wellness, where we run a hair tissue mineral analysis course and program. And we've got a course with group coaching where we'll actually walk you through testing and how to interpret it, how to look at it, supplements to use. And then we have a mastermind. And if you're a practitioner listening to this, you can skip the course with coaching and go straight to the mastermind. But if you get in and you feel like you're too deep and you need the background, you just go back and you take the course with the coaching. So it's a great, and in the mastermind, we talk about everything. We talk about working with clients or patients. I bring the internal medicine background. Clark brings just the pure hair tissue mineral analysis background. And then we talk about how do you build a sustainable business that is authentic and high integrity and doesn't compromise your quality of life. So it's a great program. We love running it, and we'd love to have your listeners join us.
That's awesome. I hope I get to see you sometime soon at another conference. Leland, but keep up the great work, and thanks so much for what you do.
Thank you. Thank you for having me on.
Thanks so much for tuning in to another episode of the Smarter Not Harder podcast, where we give you 1 cent solutions to $64,000 questions. And this episode was really interesting for me to learn all about hair tissue mineral analysis and how important it can be in clinical practice. I'm definitely going to be doing my own research and learning more about this. If you like this episode, please don't forget to like and subscribe below. And we hope we'll see you next time on the Smarter Not Harder podcast. Take care.